CPX-351 has been FDA approved in both the US and in Europe for adults with secondary AML or AML with MDS-related changes or therapy-related AML. And that approval was based upon a phase 3 trial that was performed that evaluated older adults with secondary AML and compared those patients between CPX-351 and 7+3 conventional chemotherapy. And the results of the study demonstrated that overall survival and overall response rates were significantly higher in the CPX-351 treated patients compared to the 7+3 treated patients. So as a result, the drug became eventually approved and is now considered a standard of care for chemotherapy fit or healthier, older, actually any patient, there's no age restriction, with secondary AML, which is traditionally a very difficult to treat disease. There's a lot of potential benefit from the formulation of the drug. So pharmacokinetically, it has several advantages in terms of being able to be delivered directly into the cell as a liposome. And because the chemotherapy drugs within the liposome are formulated in a 5-to-1 synergistic molar ratio, you're actually delivering the drug itself, the combination of the drugs, into the cell in the synergistic ratio that hopefully is more effective than by just giving the drugs as a free cocktail in unpredictable concentrations that then enter the cell. So it's pharmacokinetically advantageous, we think, and hopefully will provide a new platform for chemotherapy and AML in the future, just on the basis of a unique delivery system. So it's actually somewhat beneficial in the way that it's given because it does not require a continuous infusion with a long half-life. It can be administered as a short infusion on days 1, 3, and 5. So patients theoretically don't need to be in the hospital for the actual drug administration. And for that reason, there's a lot of interest in developing outpatient-based regimens to save patients hospital time. The other considerations, I think, that are somewhat unique to CPX-351 are the fact that it does tend to be more myelosuppressive. So we've reproducibly seen 7 to 10 day delays in recovery of the white blood count, or the neutrophil count, I should say, and the platelet count, which fortunately did not lead to any increased risk of early mortality, but nonetheless is something you have to pay attention to when you're dealing with this drug. The other nice side effect, or lack of side effect, is most patients don't lose their hair. So certainly hair loss can be a traumatic event for a patient with a cancer diagnosis. So the fact that this drug is typically not associated with hair loss is one minor, but I think significant benefit that most people don't talk about.